Good afternoon, everyone. I hope you've had your coffee or whatever it is that keeps you alive and energetic at 2:15 in the afternoon. Okay, so I am a physician by training. I got my training from the University of the Philippines, and for many years I was involved in an important sector of healthcare, and that's the pharmaceutical industry. Now, you might be thinking, I'm a doctor, and because I've had the training, I've had all the medicines, the knowledge about it, I'd be immune from all these diseases that we've been talking about since this morning, all the lifestyle-related diseases. Well, guess what? We're not immune. So, in the years that I was working in the corporate space, unfortunately, because of stress, sounds familiar? And all the lifestyle decisions that comes along with poor stress management, I unfortunately developed a couple of lifestyle-related diseases. High blood pressure, high blood cholesterol, and that started me on another journey. That's the journey of wellness. Now, you might be wondering what helped me as tools that today enables me to say proudly, I've reversed those diseases. Yes, you can reverse certain lifestyle diseases, and it goes beyond just prevention. And today, what I will be speaking to you about is really two things, two powerful tools. Lifestyle change, and the second one is wellness coaching. All right, now, if that's kind of somewhat new for you, let's see what you can get from this afternoon session. Let me begin by, Thank you. Let me begin by sharing with you a variant of a story that's commonly told among public health practitioners, prevention specialists, even lifestyle medicine practitioners. And I don't know if you've ever heard of the parable of the waterfall, right? And hopefully this can give you some insight as to how we're approaching health and wellness, especially in our respective organizations. Now, the story goes something like this. Once upon a time, there was a village. It was situated along a riverbank, but very near where a waterfall goes like this. All right? And every day, people would walk along the shores of the river, going about their business, until one day, the people from that village heard a scream. And they looked at the river. Somebody was drowning, and he was headed towards the waterfall. So, of course, the good villagers decided to save the person, got him out. Great, he gets to live. The next day, the same thing happened. There was another shout. There was another person who was pulled out from the water. That same afternoon, a second person started to drown. And then the next day, more and more people were going and closer to the edge of the waterfall. Now, the people of the village, because they were getting wise, they decided, okay, let's train the people. Let's train lifeguards. Let's train people to do CPR. And for people who are a little bit already drowning, let's put up a clinic and a hospital so that we can save all these people. All right, so you can imagine the effort that the village did just to make sure that everybody gets saved. Now, maybe you know where I'm going with this. One day, one of the villagers decided to walk away from the village going upstream. And the villager said, hey, where are you going? We need you here to save more people. So, that wise man said, I'm going upstream to see why people are falling in the first place into the river, and I'm going to do something about that so that people will not fall into the river. Makes sense, right? Common sense, right? Unfortunately, I think for many of us who are healthcare practitioners in the wellness industry, sometimes common sense can be a little bit challenging. It's we all know we've been talking about lifestyle diseases. How do you prevent hypertension? How do you prevent diabetes and all that? But are we going upstream to address the problem, the first place? Right? Now, let's try and relate that to how we're treating our clients, employees, patients. This was a graph that was put out by the American CDC back in 2004. And it's a guidance on what they said are the determinants of health. Now, everybody knows there's a bit of genetics, right? What I got from my parents will somehow, give you an idea of what kind of diseases you'll be having. There's also a bit of the environment. We were having that discussion earlier. In the US, it's less cold. Here, it's a bit hotter. It's more polluted here. So there could be some effect of the environment. If you look, however, what's interesting in this graph is that tiny little portion that says 10%. Only 10% that is ascribed to medical care would be responsible for everybody's state of health right now. Okay? And hopefully I'm, starting to help you think. So if it's 10%, many times, why are we spending so much time, resources, effort to build up the medical care portion? I'm not saying don't do medical care. I'm just saying that today, the state of health of this person is because it's not the medical care. Over half, 53%, is because of lifestyle. And everybody knows what that's all about, right? I don't need to tell you diet, exercise, sleep, how you manage stress, if you use certain substances, all right? So it makes you wonder, shouldn't we be throwing more resources at that portion that says 53%, lifestyle? Okay? Now, if you're not convinced that lifestyle is really important, I'm going to ask you, how many of you have read the book called The Blue Zones? Anybody? Thank you. 2 people? 3 people? Okay. The Blue Zones is what I would call a lifestyle study. This was, it's now a book, and there are several books that followed after it. It was written by Dan Buettner and his team at National Geographic. What did they do? They looked at places around the world where a lot of people would live to 90 or 100 years old. Do you want to live until 90 or 100 years old? Yes, but in a healthy way, right? Okay, so here are the places, countries, and it's pretty spread apart. There's one in Asia, Japan, Okinawa. There's a couple in Europe, Greece, Italy. Then there's one in North America, and then another one in South America. And what they found was that there were some commonalities in terms of longevity. Longevity is how long you get to live your life in a healthy way. Now, what did they find as common? Learning from the Blue Zones. First is in the area of moving. Moving naturally, in a regular, moderate way. And mind you, if you saw those places, Okinawa, Greece, Italy, do you think those are places that have a lot of gyms and exercise centers? Probably not. So what did they find? What they found is that exercising is great, but what's even better is if you move naturally, more regularly every day. And we were talking about this before lunch, if you have 2 kilometers to walk, just make the walk, right? So that's the first thing. It's all about moving naturally every day in a regular way. The second area is in the area of eating. So we were having a lot of discussion about eating. So what did they find about eating? By the way, I don't like the word diet. Why? Because diet connotes something temporary, something that you follow and then when you're tired of it, you let go of it. I'd rather talk about eating in a healthy way. And what did they find? Number 1 is a plant-centered type of eating. Plant-focused fruits and vegetables, as we were discussing earlier. Now, it doesn't mean they're asking us to become vegetarian. It's going to be a little tough for many of us. But what they found is by having a focus on plants, fruits, vegetables, nuts, seeds, all these which are proven to be anti-inflammatory. If you focus on those types of foods, you're going to get a nice reversal a lot of these diseases that are all inflammatory in nature in the first place. Unfortunately, for many of our countrymen, we don't build our meals around fruits and vegetables. Only rice. We build our meals around rice. I'm not saying rice is bad. I'm just saying that, well, let's build our meals around fruits and vegetables. At least half of your plate should be fruits and vegetables, because if you don't take your fruits and vegetables, how are you going to address the inflammation? Right? And under eating would be moderate caloric intake. Never overeat. People in those places, they don't overeat. And then if you're like me and you enjoy the wine, yes, wine. Wine is good, not too much, just moderate. It's not so much the anti-inflammatory components of wine only that keeps them healthy. It's the fact that when they take their wine, they do it at around 5 in the afternoon, when work is done, and they're sitting with their loved ones, and they're telling stories of what happened in the day that was great. So it's not just the wine per se, but it's also the connection with people. One of my favorite quotes regarding wellness is that the currency of wellness is connections. And let me talk about that a bit more. When I talk about connection, it's not just necessarily connecting with people around you. The first person you should connect with is yourself. And that's the area of finding meaning. Do you know your purpose? Have you found your purpose? Have you connected with your purpose? The Japanese even have a term for this. It's called ikigai. How many of you have heard of this term? Ikigai. You've heard of this term? Loosely translated, that means it's what gets you up in the morning. And if you haven't found that and you haven't connected with that, then it's going to be difficult for you to live a life of health and wellness, because why are you getting up in the morning in the first place? Now, the other part, which is on the left side, is about relaxation. Everybody knows this. You got to know a bit of relaxation techniques. It's still part of connecting with yourself. But on the right side, and this partially answers some of the questions that came up, there's an area of belonging. First is to prioritize your family. Second is to connect socially. If you have a tribe, spend a lot of time with your tribe. And then finally, your question earlier, Maricor, in terms of belonging to a faith community. Whatever that is, whatever your religion is, whatever your faith community is, practice that faith, belong to that faith, and enhance your spirituality. It's going to add at least 3 to 4 years to your life. Not bad, right? Okay, so you've gotten a good idea. Lifestyle works, right? It's not just about the physical, it's about the whole person. Now, here's the question. Really, lifestyle change is about changing behaviors. I was listening to the discussion this morning, and we were having that thought about, here are the programs, right? We're laying it out for our employees and our team members. Well, how come nobody's taking it? We're 10% access to the program. Why can't it be 40%? Well, really, it's the challenge of lifestyle change means changing behaviors. And it's not just one behavior. It's all those behaviors that are related to lifestyle. Now, maybe just to give you a little story about what I started at the start of this talk, that, I had to go through that journey. I had to change the way I fed myself and get my nutrition. I had to move more. I had to learn how to connect. And all these things. And here's the other thing. I'm not done yet. People tend to think that wellness is like an endpoint or health. It's not. It's an ongoing journey. So nobody can say, I am healthy and well, period. Nobody can say that. Because if you stop, guess what? Most likely you're going to go back to wherever it is you came from. So if you want to really become healthy in a sustainable way, let's focus on changing our behaviors. Hopefully that makes sense. Now, if there are 100 people in this room right now, and each one of you was thinking about making a behavior change, I'm getting some nods. Yeah, I know. There's something I need to change with regard to health and wellness. If everybody here in this room is thinking about to make a change, and there are 100 of you, only 2 of you will be making that change in the next 1 month to 6 months. Huh? You think so? Right? Change is not easy. And based on this graph, it's from an old but very relevant book from Prochaska, Norcross, and De Clemente. They talk about the stages of change. Right? I heard the story earlier of Paul. Right? He had to undergo changes as well. I had to undergo changes as well. And it took years before I changed some of my habits. Now, why is that? Because people go through at least 5, actually 6 steps before they can actually say they've changed. So, first stage, pre-contemplation. And let's take an example. Smoker. Let's name him Jake. Jake is a smoker since 18 years old. He's been smoking all his life. He's now 40 years old, and he just can't stop. Somebody tells him, maybe this doctor said, you need to stop smoking. And what does Jay say? Nah, I like it. It keeps me stress-free. Right? So in the next 6 months, he's not going to change. That's pre-contemplation. He doesn't think he needs to change. Now, 1 month later, 2 of his friends die. One of heart attack, the other one of cancer. And so he starts thinking, well, maybe I need to change. I now have 2 kids. I want to be around them longer. So I'm now contemplating to change. Oh, but that was a huge step to make that change. Now, he met a doctor who was very good, very empathetic, helped him to get over those inhibitions to change. And he said, you know what, here you go. Here are some materials. Here are some tactics that you can do to stop smoking. Replace it with something. So Jake starts to read up. 1 month later, he makes the change. He quits. Cold turkey action. But every now and then, life in the office gets stressful. So he steals a stick, puts it down. Right? He's going to fall forward, backward, forward, backward. So change is not something that you can just say, change. You need to go through all these steps. You know what Dr. Prochaska and team say when you can say that you've maintained it and that you can terminate the change? You know what they said? 5 years. So in Jake's case, if he has not smoked for 5 years, he can claim, I've changed. Now, here's a question. Is it easy to do this? Can Jake do this alone? Very difficult. It doesn't have to be smoking, by the way. It can be diet, you know. Doctor says, have you tried dieting? Yes, I've tried all of them. Have you tried quitting smoking? Yes, many times. So, this brings to mind, and this was a question that was raised earlier, I forgot who it was. Are we doing the things that will really impact lifestyle? Are we doing the things that matter to really cause that change in behavior? Now, I'm going to propose to you some mindset shifts in the short time that I have. And I'll be referencing who I would say is one of my mentors. His name is Dr. Arlosky. He's a wellness coach in the US, an author. He talks about 3 mindsets, right? Right now, and this is the kind of training that I've had when I was taking my medical education, the healthcare system that we have, what is so ingrained is a mentality of prescribe and treat. Now, I've been on both ends of the clinic table. I've been a doctor and I've also been a patient. Do you look at the picture of the patient? You don't see any faces. But this position tells you a lot, right? What is the patient doing? Give me my medicine. Prescribe the medicine, doctor. What this is telling us is that doctors are still seen as the expert. But here's a question. Who is the expert of my own health and wellness? Who's the expert of my own health and wellness? It's myself. It's not the doctor. The doctor can help prescribe a medication if you already have something, unfortunately. But if I'm going to change behaviors, and again, just like many of the speakers who said it earlier, until I take the bull by the horn, so to speak, until I take responsibility for my own health and well-being, lifestyle change is a challenge, right? So there's been an evolution to that, and you've heard a lot of your speakers share this. To complement that, there's now a second approach. You have the educate and implore. So this time, the healthcare professional provides you information and hopes that you will change. Sometimes even begs you to change. Please change. Is it going to work? Maybe in some cases. Now with all the information that's available online, I can read up, right? But what I'm proposing now is a new mindset. That one of advocate and inspire. We're now looking at a trend in the healthcare industry, leading in the US, for example, where you now have health and wellness coaches. People who are trained to help you go through the stages of change. People who will use tools to help you realize what's my own personal vision of health and wellness and what do I want to do for myself. Some doctors do that, but this time it's not about expert. Look at the picture. They're now side by side. The patient, the doctor is now an ally. They are partners. So as I end my presentation, I'm proposing to everyone a new approach, which is called the coach approach. Some of you are probably familiar with this, coaching in business, life coaching. Well, health and wellness coaching is about applying these same professional principles in a client-centered, take note, I prefer the word client than patient because client is more, we're partners, right? In a client-centered process that assumes a partnership to advance healthy lifestyle behavior change using non-judgmental dialogue, goal setting, accountability. And hopefully we'll get more people who will be interested in having a coach approach, not just among doctors. In the US, even the US Congress has passed a resolution recognizing the role of health and wellness coaches in the system. So let me leave you with this. Lifestyle change is not easy. You need to have the help of a wellness coach many times to help you advance through the changing behaviors. And really, health and wellness is not just about the physical aspect. We've stressed on this earlier. I recommend looking at the person in 12 dimensions. This is what you call the wellness inventory, a whole person framework for health and lifestyle change, which was actually developed in 1976 by one of the founders of the wellness movement in the US. And you know what the first dimension is? It's really self-responsibility and love. Until I learn to love myself and take responsibility for my own health and well-being, all the dimensions, all the wellness programs that are offered may be a challenge. I've got to do it myself with a little help from friends and coaches. So with that, I hope this sort of opens up the conversation of what some of the things we need to change in order to see and get the results that we're looking for in terms of health and wellness. And hopefully with that, in the future, we'll really see a healthy nation and healthy workplaces. Good afternoon.